is the most common question that you get asked by patients?
There are many questions. Probably one of the most common questions is the patients will ask, will I get osteoarthritis of the knee if I don't have ACL reconstruction for my ACL deficient knee? And I would say that most people who have torn their ACL are at risk for some degree of osteoarthritis, whether they have surgery or not for their ACL deficient knee. There have been no long-term follow-up studies that show that ACL reconstruction can prevent osteoarthritis. The theory behind this is there may be irreversible damage done at the time of the ACL injury that may predispose the patient to getting osteoarthritis in the future, whether they have surgery or not. Some of this damage is visible, that it may be a tear of the a meniscus, which may not be repairable, or a damage to the articular surface, such as a scuffing type injury, which may not be repairable, and this can set up the patient for developing osteoarthritis in the future. As well, some of this damage can be at the cellular level and not visible, and there are more recent studies being done with sophisticated bone scans and MRIs, which are shedding more light into this area. The bottom line is that ACL reconstruction, its main purpose is to restore function, to allow patients to get back to their sporting activities and recreational activities, and also to prevent secondary injuries such as meniscal tears and articular cartilage injuries. And someday we hope to show that early surgery in the setting of patients who don't have these secondary injuries will reduce the risk and severity of osteoarthritis in the future, especially with our newer, what we call anatomical ACL reconstruction techniques. So probably until about 15 years ago, we were all doing surgery that was not anatomical, not putting the graft exactly where it should be based on the anatomy of the knee. And a lot of our long-term studies are based on those techniques. So maybe more the long-term studies that have arisen since the advent of anatomic techniques may show better results in terms of preventing or decreasing the risk of osteoarthritis of the knee.